On Wednesday night, soccer star Neymar was injured in a game in the French Cup. Now, reports state that he was out with a left adductor injury. Let's review the footage and discuss this injury in more detail. For those who don't know me, my name is Sonam, and I'm a resident doctor specializing in sports and exercise medicine. On this channel, I break down injuries as they happen so that an average fan can better understand what's going on. Be sure to like and subscribe if you want to stay up to date. For now, let's get back to reviewing his injury. So before we review the actual injury, let's look at the anatomy in a bit more detail. So essentially, I have the left lower leg, and your adductor muscles, or when you have a groin issue, a groin strain, it is one of three different muscle groups that we're considering. So you have your hip flexor groups, which are these ones that go over. You have your adductor muscles, which are all of these guys here that are in the middle aspect of your leg, on the inner aspect of your thigh. And you actually have your ab muscles, which will come from up here and insert around here. Now, I wanted to bring your attention to this area here. So this is your pelvis bone that we're seeing kind of right along here. Right beside this area is your pubic bone, and just lateral to it is where all your adductor muscles insert. If you go a little bit over, then you're talking about kind of your iliopsoas or your hip flexor muscles, and you have your hip joint here. When someone has a groin strain, we're always worried about all of these different muscle groups, because actually the differential diagnosis is quite wide when someone says, I've hurt my hip. Is it your groin? Is it a muscle? Is it the hip joint? Or is it even your belly? So it's something that you got to consider as a doctor on the field. Now, groin injuries or adductor strains are one of the most common injuries typically seen in soccer players and hockey players. And the reason why is there's a lot of quick cutting, pivoting movements that causes an eccentric contraction of your adductors here, which puts it under stress. What's an eccentric contraction? Essentially, an eccentric contraction is the opposite of a pull-up. So if you're doing a pull-up, going up is a concentric contraction. When you do a slow negative, that's an eccentric contraction of those muscles, because there is a lengthening under load. And that's what happens when you're quickly cutting. You're lengthening it while you're also trying to contract it to some degree, and that's when these strains can happen. Now, in an acute injury, which muscles of the adductor group are typically injured? So your adductor longus, you have three main ones. You have your longus, you have your adductor magnus, and then you have your gracilis. Your adductor longus is the most commonly injured adductor muscle, and in Neymar's case, this is what I'm thinking he has. Typically in acute injuries, you'll see the actual issue along this area here called the myotendinous junction. So essentially, you'll get the tear around here. Adductor injuries are, like most tears or strains, classified in 3 grades. Grade 1 is very mild, so if anything, there may just be the slightest bit of tear, less than 5% of the muscle belly. Grade 2 is a partial tear, so you're thinking a little bit more involved. Grade 3 is pretty much a full tear, and that's surgical in many cases. Now, if you're thinking chronic groin pain and chronic adductor injuries, that's when we think more at the insertion. This is not Neymar's case because he had an acute injury to it. Now, there is 3 ways to really injure an adductor muscle. You can have direct blunt force trauma to the area. You can have a forceful contraction to the area. So that's that quick pivoting movement where you're contracting it and essentially it tears under load. And then the last is you can have a lot of microtrauma or repetitive injury. So you're constantly weak in the adductor and it's pulling on that tendon, and you can have a little bit of issues kind of within that tendon insertion. The main symptoms patients will complain about if they have an adductor injury are essentially pain, swelling at the site. Sometimes if it's really bad and they tore it, you could actually see a divot or a bruise in the area. And the other thing that we'll do a lot on the sideline is also test if they have pain on resisted adduction. So I'll stand, kind of hold their leg, and I'll try to get them to squeeze their legs together. And if they have pain with that motion, that kind of is an indication that the adductor may have been strained. All right, so now that we've looked at the anatomy, let's look at Neymar's injury. So this is the best view I find for this injury, and we'll play it at full speed first. Pay attention to this left leg there, and that's the one that he grabs right after. Now, the way that he grabs his leg, initially I think this is a knee injury because he just grabs it, pulls it up, and he looks like he's in quite a lot of pain. Let's go back. So we know now that he has injured his left adductor. Where is that? So essentially in him, that adductor would be the inside muscles of these legs. Now I am suspicious whether or not this kind of pseudo tackle may have caused him to try to protect his legs, squeeze them in, and put the adductors under a lot of load. So I'm wondering if this blunt force trauma had anything to do with putting the adductors in a compromised position. Then if we keep going down, he's turning on that side. So typically if you're falling, you'll want to contract those muscles to protect yourself as you're falling down, because the body is going to want to make sure hands are out and knees are out, so you protect the head of yours. That's the most important part. And you'll see he goes down, and then he goes down like that. So I mean, his legs are also spread out to some degree. So there actually is additional force coming in this way. So there's multiple places where he could have impacted that adductor, but because there was a quick kind of tackle movement, he may have seized up the adductors by bringing the legs together to try to protect himself, and in that case, cause that adductor strain. Usually on the field, as the doctor, when he's rolling around in a lot of pain, I'll do a few things. I'll ask him where the pain is, and if I'm really worried about the hip, we need to rule out other things like hip joint pathologies, and I've done a video on that in regards to Killian Hayes' hip and him having a labral tear, so I'll put that up here. Now, I take them off the sidelines and on the pitch and evaluate them kind of off field or in the locker room. And the biggest thing I'd look for here is I'd actually have to dig into this area here to see if there's any tenderness. I'd also feel along the muscle belly here, and if there's a gap, then I'm worried about kind of a tear in that area. And then the other really important thing is you look for swelling and bruising. Sometimes if you have a lot of bruising here, then you're worried, is there a big tear and is there bleeding going on in there? And then the last thing I'll do is I'll feel the area, because sometimes you can actually feel a gap if you go down the muscle belly to see whether or not there's truly a tear. Usually though, the gap has to be quite big to be able to feel that. Now, if you're worried about an adductor injury, say on an outpatient setting, if you're not an athlete, you can actually diagnose these pretty clinically, but in Neymar's case, he's a professional athlete, so you definitely be hopping onto either ultrasound or MRI to really characterize this injury a little bit further and make sure there's nothing else going on, and also to grade the injury. Typically, the average return to sport time, if you have a mild injury, is really 21 days. And news reports state that he's going to come back in approximately 4 weeks, although that's going to be determined. So I'm thinking that he's got more of a grade 1 or 2 injury in that case, and he's able to rehab it and come back. In terms of rehabbing it, you really need pain-free range of motion, so he needs to be able to bring his leg all the way in and all the way out, as well as pain-free full strength to be able to be cleared. And you'd start a little bit with kind of range of motion first, then cutting exercises, and then kind of sport-specific activity. With groin strains themselves, if he's had one before in the past, he's always at risk of getting another one. The other thing to be considerate of as well is we know that people with really weak adductors or inner thigh muscles are at actually high risk of getting groin strains. So for him, it's going to be extremely important to do adductor exercises. I'm going to put up one here, a picture. It's called the Copenhagen plank, and it's one of the most classic exercises. If you ever try to do one at home, they're extremely difficult, but they're amazing for adductor strengthening. We know if you strengthen them, you decrease your risk of groin injuries. And especially in a soccer player who's at high risk of this, it's actually something that we really try to put into an athlete's exercise plan, especially if they play soccer. Now, I hope this video provided you with a little bit more information about Neymar's injury. I know he's going to be missing some really important matches upcoming, but hopefully he should be back after about 4 weeks. If I have any updates, I'll put them down below. Now, if you like this video, please like and subscribe to my channel. If you have any questions or comments, please leave them down below. For now, that's all.